Good afternoon. Thank you for joining us today. My name is Erica Bain. I'm the Program Operations Specialist in New York Connects here at Tioga Opportunities. Today's presentation, we will focus on different types of grief during COVID-19. I acknowledge that this content may be difficult for some. I encourage you to take care of yourself if you need to. Please feel free to step away from the presentation if necessary. Mental health staff is here if you need additional support. Before we get started today with the panel discussion, I would like the panelists to introduce themselves and give us a brief overview of the services your agencies offer.
My name is Emma McCarthy. I am the self-sufficiency facilitator here at Tioga Opportunities. I have a COVID focus, so I'm helping people in crisis for any reason due to COVID. A lot of it is normally needing financial assistance or some mental health guidance, and then we can refer them to other agencies. We also have an array of other services, and if you're interested in that, you can go on our website or you can contact Erica.
Good afternoon. I'm Christina Olivano. I'm the Prevention Services Supervisor for Tioga County through CASA-Trinity, and also the Project Director for Tioga ASAP Coalition, our Substance Misuse Prevention Coalition throughout Tioga County. So through CASA-Trinity, we provide prevention education in schools and communities for families and parents. We also provide support services. We do one-on-one grief intervention for adolescents, and we also do a lot of community trainings on many different topics. And through the coalition, we do so much. It's hard to summarize quickly, but our focus is on engaging community members and community sectors in a variety of activities, events, and campaigns that help to reduce the social norms of substance misuse and also just provide support and resources.
Hi, good afternoon. I'm Sarah D'Annunzio. I'm the Assistant Director at A New Hope Center. New Hope Center is a crime victim service provider for Tioga County. So we primarily are working with people around issues of abuse, people who have experienced abuse directly or witnessed abuse or are affected by abuse in some way. So that includes domestic violence, intimate partner violence, sexual violence, child abuse, human trafficking, and any other crime. Our services are free and confidential, and we meet with people of all ages, all genders. There's no income guidelines. We offer supportive counseling around issues of abuse. We have advocacy services. We're working with people to access services such as family court, law enforcement, social services, other applicable services. And we do provide safe shelter for people who are leaving an abuse situation. We have a 24-hour hotline and text line and provide other safety planning. In addition, we also focus on prevention work, the idea of the hope of preventing violence from happening. And that includes school groups and other community education.
Hi, my name is Sarah Beagle. I'm the Deputy Director of Community Services for Tioga County Mental Hygiene. And our agency is responsible for mental health and substance use services in Tioga County. We have an OMH license program with school satellites at some of the local school districts. We have a Waverly satellite clinic that offers mental health counseling. And our Oasis clinic operates mostly out of Owego. We also have a peer now that can go into the community and work with people who are pre-contemplation stage of addiction, whether or not they want to get treatment, and try to engage them into the outpatient level of care. We have a psychiatrist and a full-time nurse practitioner, so we can do psychiatric prescribing, medication management services, and we offer that also in our Waverly clinic. So if anyone's interested in services, you can walk in, you can get an intake on demand, We also offer that over telehealth, by Zoom video or phone, if it's not convenient to travel. We have phone crisis services after hours, just contact 687-1010 and ask to speak to crisis worker. So that's after hours, holidays, and weekends.
Thank you, ladies. All right, we'll get started with the questions. So the first one we have is, how has COVID-19 impacted the population that you work with?
So being the self-sufficiency facilitator that dominantly works with only people experiencing something due to COVID, I didn't really have a before aspect. So a lot of people are coming to me looking for financial assistance is a big one, like I mentioned before. So helping them with rent, utilities, mortgages, supplies for their children, being home, food, all of that. And a lot of just feelings of panic. So I don't know how I'm going to pay my rent tomorrow. I don't know if I'm going to get kicked out. The moratorium is in effect. What if that ends tomorrow and I can't pay that? So just a lot of guidance through how to deal with those feelings and what the next steps and planning will be for them.
So I think in the population that we work with through CASA-Trinity, I don't think it's any surprise that COVID compounded substance misuse factors, and that we saw an increase in alcohol use, alcohol sales, alcohol use. There was an increase also in overdoses during the COVID-19, the peak of the COVID-19 pandemic. Recently, CDC actually released that 81,000 overdose deaths occurred the 12 months prior to May 2020. And that was the highest recorded overdose deaths in a 12-month period ever. So I think there's a lot of factors that contributed to an increase in alcohol use, an increase in substance misuse, increase in overdose deaths, and isolation, and some of the things that Emma spoke to, just stress, worry, anxiety, daily routines changing, and really nobody knowing what was coming next and how everyone was going to cope with what was coming next. So people already experiencing challenges with substance use, people in active addiction, and people in recovery. All populations were impacted by the COVID-19 pandemic.
So, just as Christina said, all of us have been impacted. So certainly, that with anyone that we're working with, they're kind of dealing with all the unknowns and all the challenges and all the things that we've all faced. And then additionally, for people we're working with who are experiencing abuse or being abused, we talk about abuse being about someone trying to have control over or power over someone. And that could be over a child or over an adult or a partner. And some of the tactics that people often use are to isolate people and to limit their support systems, to make people feel alone and that they don't have supports and it's something wrong with them kind of individually. So COVID-19, kind of the isolation that we all experienced in different ways, was certainly kind of used and exacerbated by people who were being abusive. They would take that opportunity to further isolate, and if people didn't have the supports of typically being able to maybe go to work or socialize with friends or family, that was an opportunity for someone who was trying to exert control to use that as a tactic.
So, echoing what everyone else has said, I think COVID-19 really impacted everyone a little bit differently. we work with population from kids all the way to elderly adults, and we have obviously both the mental health and substance use programs. So I think we saw an increase definitely in relapse and people in need of substance use treatment because of the lockdown. We were sort of forced to offer services only remotely, and I think people were stuck at home. So I think that impacted the substance use population by not having that face-to-face interaction and group therapy that really works well with that population. Mental health wise, people were experiencing an increase in depression, anxiety, isolation, which can compound those issues, fear of the unknown, and trying to manage that while also, losing those face-to-face interactions with their therapist or prescriber and learning how to do that remotely. Kids are always so resilient, but they, I think they were also impacted differently. They're forced to go on Zoom for schooling, and then, trying to do that therapy modality that way wasn't necessarily the best fit for kids, I think, but better than nothing. So, and then I think, post-COVID, it impacted people differently. We did see definitely an increase for people requesting services, wanting to come in person, wanting to get back to normal, and come in and still get their needs met. We now have, a hybrid option where, people can come in and get telehealth services. They can also come in person. So hopefully we can keep it that way. Carrie Tornado is one of our mental health social workers in the school, so she might be able to speak also to how COVID impacted the population she works with.
Sorry, I might have finished the session. Okay. Hi, so I'm Carrie Tornado. I'm a social worker. I'm a therapist that works in the Owego Appalachian School District in Owego Elementary School. I work with children and their families. I have done a variety of in-person, telehealth, and hybrid, both screen and person in my office therapy throughout this whole pandemic. So it's been a good learning experience. Anything else? I can ask you the question.
Sure.
How has COVID-19 impacted the population you work with?
Well, starters, it disrupted their whole education. I work with elementary school students and their families, but also adults. So it disrupted their family life, their brother and sisters' family life, their grandparents, their parents. So probably every aspect of their life. Their school turned telehealth for a very long time. They had to relearn how to do everything that they've ever known or been used to. The way they interacted with their family has changed. Some family now, they can't visit as often. Some families, they're only talking to on the phone or in the videos. Their parents also are going through the COVID, so they either had to keep working and kept working in different ways, or maybe their job ended, and then they're trying to do school, and parents have to navigate what they navigated, and then extended family members, like I said, their changed communication, how they communicate, how often they communicate, and how they relate to their friends and their peers have now changed, because now they have to stay 6 feet apart, and they had to relearn how they interact, how they socialize with people in school, in a store, and then in their personal life, it's all kind of different. So probably every aspect it's hit these kids.
Okay, to kind of follow up on this first question, did you see an increase or decrease in people seeking support during COVID-19, and why do you think that is?
I think we definitely saw an increase, a lot of, like I said before, people looking for financial assistance. And I think that's just because there was a lot of panic with losing jobs, not knowing when we would be able to return to some of those jobs, or maybe they would be closed permanently. A lot of, small businesses weren't able to open up because they couldn't keep themselves up on their feet during this time. So a lot of people just needing that extra assistance from their peers, their community, and then also the government with financial resources. And I think we can view that both positively and negatively. Positively because now we have more connections within our community to assist people, and we're doing this so that we can assist more people by us knowing what each other agency in the county does. But also negatively because we don't want people to be fearful or isolated or concerned about what tomorrow brings.
So I would say for us, it was probably both. We definitely had, by no choice, to decrease some of our services and the support required, because a lot of our services to provide education in schools, and so schools shut down, which means we shut down that part of our program, and there really wasn't anything anybody could do about that in the beginning. So there was a definite decrease and a change and shift in how we had to do things in the beginning of COVID. But we did see an increase in some of our coalition participation and things that had to do with like community outreach, community togetherness, and our coalition meeting attendance. We had, like, in the beginning, 20-something people coming to our virtual meetings. So I think for CASA-Trinity prevention and the coalition, it was both. The decrease by necessity in some areas, but then there also seemed to be, initially anyways, an increase in interest in like coming together to see what everybody could do to support the community needs at that time.
Yes, I would echo just as Christina was saying. I mean, it changed our services in ways, and so we both had kind of a decrease in things like our school prevention groups we weren't able to do anymore. And initially, I think just as we struggled as an organization to figure out how can we continue to provide services, how can we do that, people weren't sure, even in the community, like, are they still open, or what are they offering, or how are they offering these services? So that was certainly part of our strategy, was figuring out how do we continue offering all of these services, our counseling and advocacy and help with court petitions and shelter. And so we were able to maintain all of those services, but did have to shift how we were doing it. So we saw an increase in some needs that people identified, like concerns about custody and visitation, often even related to COVID concerns or what their rights were or options. Safety planning in different ways, thinking about if you're not able to leave for work or to visit with people, how can we talk about safety? How can we even have those conversations if it was going to be virtually or by phone, or those ways to do that safely. Our numbers, when I looked back, like kind of statistic wise, stayed steady for the year. So we serve about 1,100 people a year, and our numbers were about that still. Back. This year, our numbers have increased, and again, in certain areas like our shelter need, and that's been, again, an initial part of COVID-19 kind of restrictions and pandemic. We were still operating, but of course people were concerned about coming into a communal shelter living. So, the idea, like, maybe the unknown of that sometimes can be a lot scarier, more concerning even than kind of the known of what I'm experiencing right now. In the past several months, as things have begun to open more, we've certainly seen an increase in people identifying the need for shelter and the need for family offense petitions, which are for orders of protection for safety. And again, that's been, when I was kind of looking at our numbers over the past 4 or 5 months, an increase. And again, I think that's a reflection, I'd likely think, of people now feeling like they can reach out or consider what other options might be. But at the time that was really, for many of us, so many unknowns.
I do not think our services decreased at all. In fact, probably they increased. I did not lose any of my clients. Whoever I was seeing when school closed, I continued to see them. And throughout the whole the stay-at-home, close down, and summer, I kept in touch with all of them. I continued to have therapy with their families, and actually, what it did is it allowed me more access to their families versus just seeing the kids in school on their own. So I got to see them at home. I got to sit and have a family session every week, which is actually more powerful. So I would say in our whole clinic, we didn't see it decrease. I think actually we saw an increase. We didn't skip a beat. We just, the next day, we called all of our people, and we continued to have sessions with all of them and check in with all of them. And then I think we had an increase of people seeking support from us because of the isolation, the anxiety, the uncertainty. And so we have our open access and telehealth services that they can just call whenever they need. So that really just the access increased. And so the people we serve, our numbers went up, but I'm pretty sure they did. We were really busy, and we spoke to a lot of people.
Yeah, I would say, just to add to that, as far as numbers go, I know that at one point we would get, like 15 intakes a day in our mental health clinic, and that was probably towards more post-COVID, after people were just done with isolating and, being cut off from the world. But all of the therapists did a great job at just, keeping their caseload steady, keeping in contact with people that were already in care, that wanted to stay in care, even though we were moving to like a more of a remote style of services. And at this point, we continue to get, lots of requests for services on a daily basis, and we're trying our best to keep up with that.
What were people seeking most from your agency during COVID-19?
I guess I already answered that, I would say, right? Yeah, so kind of more of a shift initially what people were looking for at the time, and always with safety in mind, just different considerations about how that was affecting people.
Something that we saw were a lot of people searching for how to get the vaccine. So that's something we kind of stocked up to help with. A lot of people that we serve are 60 plus as well. So sometimes they don't have the technology or previously weren't interested in the technology. And as you know, a lot of the vaccine signups were online. So people kind of, once that was available, how can we get it? How can we keep myself and my family safe? And we took names and helped them schedule and transportation if they needed that to get to their appointments, and pretty much anything that somebody asked for, we'd find a way to kind of get them where they needed to go or get them the support that they needed.
I would say for us in the beginning, it was really a matter of us serving as a resource and a connection point. So I know I fielded a lot of phone calls for people just looking for stuff, and so sending people in the right direction to get the resources they need, whether it be Tioga Opportunities, the New Hope Center, mental health, ADS. I also was in contact with some of our law enforcement as they were looking to also help people during this time, and being able to connect them to peers and other resources while they were out in the community, coming face to face with some people who were in active addiction, or they would respond to an overdose in the county, and then wanting to know where are we sending people, what's going on. And so we served as like a referral point for a big part of the beginning of COVID, especially.
All right, we were people's supports. So when they found themselves so isolated, they knew that they could call us and we could be that source of support during this, someone to talk to discuss other fears and worries, anxieties about, but also we were a source of information too. So luckily we kept in contact with the county agencies, other agencies about what they were providing, where they were providing, and we could relay that information to the people that really needed it. And then we got to support them while they went through this, talk about their uncertainties, have some sort of answers if we could, and just help them navigate this uncertain and anxious time. We were connections. I was a connection back to school that the kids were struggling to have. I could provide connections to other family members too through multiple Zoom sessions. I could invite other people in where maybe they wouldn't have access to that before. And so I would say support and information and connection is what we were doing. I know that we also worked with other agencies and we had a couple of vaccine clinics where we had people come into our facility to get vaccines, and that was coordinated. So I know we did a lot of that community outreach work.
And just in addition to that, obviously the services that we most frequently offer, which is mental health counseling, substance use counseling, and medications. I think people were looking to stay consistent, continue seeing their prescribers. They were coming in person still if they needed injection medication, and so we were that consistent piece for that.
What changes, positive or negative, did you see in the community during COVID-19?
I think one of the big positives were people just supporting each other. I think that Owego specifically was, donating food, for small businesses, or having online virtual events for families, just kind of trying to give an outlet for everybody to kind of take a break. I know there was a point where it was hard to take a break because we were so immersed in it and not sure what was happening. But I think the community was extremely supportive, and like a lot of the ladies on the panel has said, referring to other agencies and getting to know other agencies well enough that we can send our customers there to get any type of service that they needed.
So I was honestly just blown away by the response in this whole county. I think it was incredible to see how fast things got up and running, and how like the food district, thinking of like the food distribution. I mean, it was like 3 days, and there was all of these food distribution sites scheduled, and people were on the Facebook, like the community forums on Facebook, and just also providing support, encouraging words, thanking essential workers. And I know that there were negative things that happened because of COVID, but I think that what was really evident was the positive, like, community connections that came out of it. And that when it really, I feel like for this county, when people feel people didn't even really have the chance to feel unsupported. I feel like the response was just so swift to get things up and running and try to continue to provide whatever services we all provide, but also to fill in these gaps that were completely brand new, unexpected, unpredictable, and I just think it was an amazing job by everyone.
Yeah, I mean, I echo that I think Tioga County, we've had this strong kind of community response to, all sorts of different situations. I'm thinking sitting here, in fact, 10 years ago when we had the major flooding, we at a Hope Center, we had lost our office. And at that time, Tioga Opportunities offered a space to come and kind of keep functioning. So we were here like using an office space while we were trying to rebuild our offices at the same time. So, I think, thinking of that kind of those circumstances and the response from the community. And I also saw that happening during the COVID-19 pandemic and how organizations were supporting each other and filling in those gaps and being so innovative with that, thinking of ways to kind of do outdoor distribution of materials or dropping things off for people or, finding ways to kind of offer those virtual services and definitely like the social media as we all kind of communicate and connect that way, sharing other organizations' information. And so, I definitely saw that highlighted strength of Tioga County and connections and collaborations for sure. And a negative, I mean, I don't know that it isn't specific to Tioga County, but just something that we experience for sure is kind of the housing struggle for people, which is always an issue. I think this was certainly really exacerbated during this time. We're still experiencing that of people not being able to find housing and find affordable housing. So that just came to mind thinking of one of the struggles of the community.
Okay, so like everyone said, I'm gonna echo what everyone said. There were definitely negatives, and I would just say one big general one was loss. There was just loss across the board. But also what I found interesting was all the positives, and there were a lot that people supported each other from afar, and we had to do it. But I find one of the most interesting one is how flexible we became to be. Maybe we didn't realize how flexible we could be, but we sure were. We were patient. We went through all this change, and I felt it from the school, but I could feel it from Tioga County, this kind of we're in this together kind of mentality, and that we're going to be flexible and patient together. And I think that was really helpful in telling. And I think this made people more conscious about their own health and well-being, which probably made our numbers go up and all of your numbers, people seeking services, because now they're realizing they do need to take care of themselves. One of the things I actually physically noticed was that there were a lot of people out walking. They were out walking with their families, with their pets, with their neighbors. And I had never seen so much physical activity before. It was amazing. I think our parks and all of our, hidden gems out there in nature all got renewed. People discovered new things, new places that were just free and around here that they could do that they never thought of doing before. So I think that kind of new discovery was really interesting to see too.
And I don't know if this is necessarily in this community alone or in communities across the board. I think people recognized time that they had spent working before, being forced into a lockdown sort of forced people to be home, forced people to be with their families. So that could be a positive thing or a negative thing, depending on the family situation. So for some people that was, I get to spend more time with my family and focus on the kids and sit down dinners and all of that. And for some people, if there was, domestic violence in the relationship, it's, I really can't be in this small space, with these people. So, it depends on who people were, but, I noticed that there is, a lot of changes too in the way we do things. So for us, we didn't have telehealth services prior to COVID, and it was something that we had been looking into, and we were going to be putting in place. And of course, like COVID hit, and it was like, okay, let's go right now. We're going to do it. And how flexible the staff was and clients, with being able to learn how to use these new tools and put them to use, and like not skip a week with providing services or getting services. So.
Okay, how have you or your agency supported and adapted to the COVID-19 pandemic?
I think that we've kind of already answered a lot of this. So just being a person or an agency that can be flexible. And I think that was the most important part of anybody's needs is we don't know what's going to happen next. So let's just do what we can, and whatever comes next, we'll figure it out. And I think that's still happening. So obviously COVID is still prevalent. We're still, finding out new things and trying new things, and don't necessarily know what's going to happen tomorrow or next week. So just the flexibility and staying hopeful so that we can be present for our community and the people that we serve.
Well, CASA-Trinity Prevention and the Coalition, we tried to do as much as we could to support the community during COVID and continuing now. We were hosting virtual family scavenger hunts, virtual trivia nights. We were offering, gift certificates to local businesses to try and continue to support local businesses when they were up and going. We had gift certificates and things like that we were providing to encourage family dinner time. We also, I'd like to use this opportunity as this point in time as an opportunity to say that when schools came back in the fall, particularly Newark Valley, Owego, and Waverly, they did not skip a beat with having us coming back in, trying to do the best that we could in terms of whether it was in-person, hybrid, virtual, some combination of both or everything, being able to be flexible. We were in person one week and then virtual the next week and hybrid the week after that. And I just cannot commend, all of the schools are great, and we did partner with all of the schools in many ways. But Newark Valley, Owego, and Waverly, where we provided the bulk of our prevention education, we were able to continue providing services largely as a result of those school districts at 90% of where we were prior to COVID. And so that to me was just, that was how, we supported the community, but it was also how the community supported us. And that I didn't want to be left unsaid because it was critical to our continued funding and function, and then also allowed us to be a part of the school community and do what we have been used to doing and love doing the best. So I thought that was particularly incredible.
Yes, our agency had to adapt, and I need to be louder. Okay, sorry. So we continued, as I mentioned, providing, the same services that we had been providing prior to the pandemic. So continue with counseling and advocacy and petition help and even accompaniments, but it just shifted in how that happened. So we were able to offer services kind of virtually, so through Zoom or through phone. We had already been using kind of a process where we could route calls to us at home that would go through an internet-based program. So that was perfect timing that we had our phone system set up like that. So some people could be working from home while some people were in the office. Which also allowed us already to have text communication with people. So for some people, that was a safer option for them to text with us, or if they didn't have service but had Wi-Fi access, they were still able to communicate with us For some people that weren't safely able to communicate with us from home, we still had someone at our office, so they could come in and even have their own private space within our office to talk to someone, from that space. And we did continue to operate our safe dwelling, our safe house during that period of time. So really the idea of just trying to be flexible and trying to adapt and figure out ways to do it, was our plan.
Okay, so we continued to support the community the way we did and then we adapted and had to change just like everyone else. So we supported them. We helped them feel less isolated. We hopefully gave them connections, education, and we also, like Sarah said, kept the consistency going. We kept their care going. We kept their connections going. We helped them reconnect with their PCP, with their regular doctor too, if they were having other issues. We would connect them to other community support agencies, even the new ones that popped up. We had to keep up, figuring out where and when services are, where and when can you get food, how do you do this, things like that. We kept the connections to the school that we had, and also, like we said, we also, going forward, we coordinated how to make some vaccination clinics so that we can help the people that we serve. Also, continue their health and wellness. We continued, having our groups, doing mental health treatment, serving new mental health people with assessments, serving new substance use treatment services. We had to figure out how to do groups again, because we know groups are really important for substance treatment, and we figured out how to do that. So we supported our community by being as flexible as we can and meet them where they're able to get services from us and add new ones where we needed to.
I'd like to add too that we, and probably all of you too, served as an agency to share the correct information to our community. There's a lot of things out there on social media that we would get calls and concerns about that it just was not the correct information. So making sure we have the most up-to-date things, whether that's on housing or the vaccines or the financial assistance or whatever it is, making sure they're getting the correct information and not things that people are just sharing without reading. So
what signs can people look out for that someone may be going through a hard time, and how can they be more supportive?
I'll definitely let mental hygiene kind of spearhead this. But I do want to say, just be paying attention to the people in your lives. Any sort of deviation from their normal can be a sign that they are struggling and need some support. So just be checking in and reaching out.
I will also largely defer to mental health to answer this, but I do want to add that, I did have an experience during this time with someone who, I think it was hard to decipher that they were having a hard time. Like, it's not always what we think it's going to look like when someone is struggling. And I would have never known. It wasn't like an outward thing. It wasn't a very obvious thing. And luckily this person just trusted me enough to share eventually what they were struggling with. But initially I would have thought this person was handling it all in stride and adjusting very well. So I think that's just something to kind of keep in mind, that there are warning signs, but then everybody is also unique.
So I will also pass down to mental health hygiene. Just to mention, thinking of when people who are being abused or experiencing abuse, certainly if you're seeing someone in your family or your friendships or your coworker or someone that you're serving, providing services to, and you're concerned maybe because they are seeming more isolated, or they're missing appointments, or they seem to be experiencing some sort of concern about how they're expressing themselves or what they're sharing with you. That it could be many different reasons, right? But we definitely like to encourage people to speak up and ask about that. Because sometimes we'll kind of hesitate, and maybe it's nothing going on with them, maybe it's they just haven't been sleeping well or something. But really, if you have the opportunity to kind of talk to someone privately, not with their partner around necessarily, but just to say and kind of name what you see, and then offer support in that way. So, I noticed you've been missing a lot of the phone calls that we used to have and not calling me back, and I'm just noticing that and want to let you know that I've seen that going on, and if you want to talk, I'm here, and offering that in a non-judgmental kind of pressuring way.
I think you pretty much you hit the nail there, right there. That was good. I think we need to say more when we see, and like you said, just point out what you notice. You don't have to say anything other than, you seem tired. Is everything okay? Or how are you doing today? But maybe ask it in a slower way or in a different way than we usually do. I would say what we will notice is a change. So a change in what they're saying, a change in what they're doing, a change in how they present, what they look like. Maybe they're not taking care of themselves as much. Maybe you notice they're not changing their clothes as much. Maybe you're not noticing them at all because they're not coming around and they're isolating more, but just something different. Sarah said, you're not calling me back like the way you used to. We're not speaking as much anymore. Maybe they're staying away from things that they used to do, maybe clubs or groups or a job, that can tell you. Or maybe they're actually saying things, but maybe they're saying it with a laugh or a smile that makes you wonder, but they're saying the words. So I guess I would look out for some things like that. And like Sarah said, you can always ask. My one go-to phrase is ask one more question than you feel comfortable with, and see what that does for you. That might actually open up some doors. Sometimes we get afraid about being too nosy, about being out of line, or not wanting to be a burden. But sometimes when we just ask the question or open up that you're here, that can actually make someone feel more comfortable and want to talk to you more.
The only other thing I guess I would add is that sometimes things will look differently in kids than in adults. So, you might ask the question and they might say everything's fine, or not answer your question. So it could look like irritability. It could look like withdrawal from activities that they used to love. It could look like, not answering your questions when you ask when they used to, or coming to the dinner table and really not having much to say. And I think during COVID, because everyone was locked up at home and isolation was more prevalent anyway, it was hard to tell, like, are they staying away from their friends, or people staying, because they can't go near their friends, or because, something else is going on. So just keeping in mind that it looks different in different age groups. And the other thing is, for substance users, you might just notice, kind of erratic behaviors, or something that might tell you that they have relapsed, and so that is, that's another thing to look at. You might see an increase in mental health symptoms, just odd behaviors that you don't normally see in that person, and it could be either or. So I think it's good to ask the question.
We know that there have been multiple types of grief people have experienced during the COVID-19 pandemic, such as loss of a loved one, job loss, reduction in hours and or wages, etc. What type of grief are you seeing people struggle with the most since COVID-19? And what advice do you have for individuals who may have experienced multiple losses during the pandemic?
I think here at Tioga Opportunities, we've kind of seen all of the losses all across the board. And one thing that I want to say to all of our people is that nobody's loss is better or worse than yours. So if you are struggling because of whatever type of loss it is, your feelings are valid and it's okay to feel that way. I think we've had a lot of people I've had a lot of people who have kind of said, you know, I lost a reduction in hours, but you know, my neighbor completely lost their job and they don't get to go back. And kind of downplay their loss, even though they are significantly struggling to support their family as well. So just because somebody seems like they may have had it better or worse than you does not mean that your loss or your feelings are any less important. So just, I would say, own those feelings and, you know, get the support that you think that you need. And even if that's just talking to somebody and having them listen without trying to give you advice or a solution, sometimes we just need somebody to listen. So whatever loss that you have had, it's okay to talk about it. And, you know, any one of us has a safe space and a judgment-free zone for you to express those feelings without feeling the judgment or the pressure or better or worse than somebody else's feelings.
Thanks, Emma, for saying that. I think that's so important to know, and that I'll just tack on to that. Even if you hadn't had a loss, we all experienced grief. I mean, this was, and still is, just an overwhelming situation that we all find ourselves in, whether you were able to, you know, maintain employment, stay safe and healthy, and the people that you love stayed safe and healthy. It doesn't mean that you're not experiencing a certain level of grief for just the total widespread overhaul of our entire world. Really, this was something that, you know, it wasn't just to Tioga County, it was New York State, the United States. I mean, it's something that has impacted our entire world in which we live. So I think even if you didn't have like one of the losses that was mentioned, grief is still there and it's still real. And I know sometimes I feel like, you know, is this really still happening? Like, is this real? And there's just sometimes a feeling of disbelief that we're all going through this. So I think you don't have to necessarily have experienced one of the losses to have the feeling of grief associated with this pandemic.
With our work, we often talk with people about the loss of their relationship, you know, which can come as a result of the abuse they're experiencing. And certainly the loss of a relationship can impact so much, and it can impact kind of even our sense of ourselves, our loss of identity as, you know, as a partner, or, you know, in our family situation, you know, a loss for our hopes or what we pictured our future would be like. But it can also impact kind of losses that, you know, we mentioned some of the loss of housing or employment, some of that kind of stability we may have known, you know, that may have all changed, and then certainly be exacerbated, you know, by COVID-19. So I would echo the idea of kind of that emotional support, no matter what your experiences, your losses are, and you know, whether we're talking about it on a community level or a societal level, or kind of your individual situation as well. So that emotional support, that, you know, it's your experience is valid, and that you should be able to talk about that. I know specifically for abuse, often people feel like, well, if that was, you know, this person was treating me badly or the situation is bad, you know, I'm not supposed to talk about that. I miss them, or I miss what I wish could happen, or, you know, that feels like a loss to me. So that's always a really important message we want to share is whatever you're feeling is valid, you know, that you deserve the support. And then also other advice is also remembering kind of your physical support and physical needs and how important that is. You know, all of our needs to still be trying to get sleep and, you know, eating well and taking walks as you can and doing those things, you know, to help support yourself physically as well.
Much like everyone else is saying, I think we all did actually experience a loss. There was loss across the board, loss of normalcy, loss of consistency, and loss of connection in just all the general ways that we can explain those terms. So I think we all experienced this loss, and it's a shared loss. So what I would say, what I would encourage people to do is to talk with your support systems, with your family, with your friends, with us about those losses, because we do know that sharing that experience, talking about it, is very healing and helpful. You know, and that we are all in it together, and that you are not alone is a very helpful and powerful piece to realize. That whereas people may not experience the same exact loss or grief or feeling that you are, but there may be similarities, and that when you start talking to people, then you can see how people can move through that, and that you are able to reach a healing state. Because sometimes when we're really in there, we can't see that. We can't see that there's that light at the end of the tunnel, that there's an ending, that we won't always feel this way. You know, and sometimes we just need someone else to say, yeah, I've been there, and here's where you can be. So I would say talk with someone, but also to build on what Sarah said, to be mindful of what you're doing during the day. Find activities that you did love, or that maybe renewed love, or a new love that you're interested in. Get outside, get some exercise, do a home project you've been wanting to do, but get lost in these activities and be mindful of what you're doing in the moment. So I know it's weird to say, but fall in love with doing the dishes. You know, like doing the dishes, but be there in that moment instead of you know, focusing on some negative thoughts or negative feelings. You know, just start being mindful of what you are thinking and what you are feeling, what you are doing.
Yes, those are really good tips. And I think, you know, getting lost in things that you love is a really good point, because, you know, during this pandemic, and I can remember the same thing happened during 9/11, you know, our media outlets and news coverage tends to be 24/7, all about, you know, what's going on, what are the numbers, what's the death toll, and a lot of the negative aspects or the scary aspects of what's happening, and it's just not repeat, and it's, you know, over and over again. So, you know, my tip would be, like, turn off the news, turn off the TV, take a break, go for a walk, go outside, enjoy your family. If you're isolated or you can't be with your family, maybe it's your next door neighbor or your local cohort or community that you're able to connect with, you know, and building those smaller support groups of people that are nearby that, you know, they are experiencing the same thing, even if it's not the same thing. And that would be a really good place to start. And then obviously your local mental health clinic is here, and you can call us anytime.
What would you say to someone experiencing survivor's guilt after the death of a loved one during the COVID-19 pandemic?
It's okay to feel how you're feeling. We do know that grief has certain specific feelings. We call them the five stages, but they're not stages, right? So there's depression, denial, anger, bargaining, and acceptance. They are neither a cycle or a linear list. They are all just normal feelings that we have during this specific time of grief and loss. And all of those and any other feeling you may be having are the right ones to have. It's okay to feel sad in these moments. These are the right moments to feel sad. It's okay to wish that that person, that loss had not happened. It's okay to start bargaining and say, if only the doctors did that, if only I did that. What I would say is to watch out for is when someone gets stuck in one of those. People can get stuck in depression. They can get stuck in anger. They can get stuck in denial and get stuck in bargaining. We're kind of okay with stuck in acceptance, but they're always a movement. So I would watch out. Maybe if someone can't move past the bargaining stage, if only I did this, if only the doctor this, if only we noticed that, if only they said this. Maybe they're stuck in the anger phase. And what we're noticing is irritability, is snapping at everyone, even when it doesn't have anything to do with the loss or the grief. Maybe they're getting into fights more often. So sometimes we can get stuck, and that might be a time that you would reach out and say, hey, I've noticed you're having a hard time. Do you want to talk? So I would say it is okay to feel all of those feelings, and it's okay to say those feelings out loud. Notice that you're having those feelings and let yourself have them. A lot of times people struggle with, well, but I was crying and I don't want to cry. But I would say it's okay to cry. That's part of our body's healing process. A lot of good things happen in our brain when we cry. And so don't hold that back. Let yourself have a good cry. Even if you need to yell, you can have a good yell too. I wouldn't yell mean things at people, but you can release that feeling that you're having. Certainly you can come talk to us. It is not a bad thing to come talk to one of us, to talk to a professional versus a friend. This is what we do. There's nothing wrong with you or anyone else who comes to talk to us. It is not a bad thing. And I would say reach out, if you're struggling with that, much like lots of people do, getting stuck in one of those stages, it's best to come talk.
And also listen without judgment. If you're a friend or a family member and you notice somebody's going through these things, I think we can have a tendency to try to offer solutions and to make things better, but sometimes you just can't make things better. So just listening, validating, letting them know that those feelings are okay. And if it's something that you feel like you can't handle, letting them know that maybe they should go talk to a counselor. And then the other thing is that, feelings are involuntary. What we can control is our actions or our reactions. So, without holding your feelings in, having a good cry or a good yell or whatever, and just making sure you're not infringing on other people's rights, or causing harm to someone else or yourself. So outside of that, you really can't control how you feel.
What tips do you have for the people you serve in dealing with grief? And maybe touch on how do you yourselves handle grief?
I think it's worth noting that what works for some people may not work for you. So getting advice from people that are saying, oh, just do this. It's okay if that doesn't work for you, but try to find something that does. So early on in the pandemic, I myself was going to therapy, and I kind of had some people in my life that were maybe a little offended, thinking that I thought I couldn't go to them. And that, of course, wasn't the case, but it was important to me to have somebody not as involved or going through the similar things that I felt like I was going through. So having somebody to talk to that was outside of, my specific situation, and then me keeping busy. If I, just sit on the couch and watch TV, like that's okay for a little while, but then, I kind of find myself falling into habits that maybe are not good for me. So, I picked up gardening, and I like to read, and I'm really into, my houseplants or going outside with the dog. So find something that works for you. If being outside sounds terrible to you, then don't do that. But find something that does work for you, and then share that with others, because that might work for them, might not, but it's worth trying something new to help kind of relieve your feelings.
So I would say also during the COVID pandemic, I also was seeing a therapist for a while, and prior to and during COVID. I think it's really helpful, like Emma said, to have somebody who's not so invested in maybe the outcomes of my feelings and life and choices, and to be able to offer that, maybe different perspective than someone who's sort of ingrained in my life. So going back to Carrie, like, why am I blanking on your name? Going back to what Carrie was saying, it's like there's nothing wrong with you. I went for a short, like maybe 6 months, and then I felt like, okay, I don't think I really need this right now, but maybe next month I'll decide that I need to go back and talk to somebody again, and I think that that's perfectly fine and healthy. So that's certainly one tip. It's like going to see somebody professionally. It doesn't mean that there's anything, wrong, and it also doesn't mean you're committed to it for the rest of your life. It's like, I'm experiencing this in this moment. I'm going to go talk to somebody, and when I feel complete, I can move on. Also, I think it's like what I do for, again, what Emma said, what I do to handle grief is, totally different than, for example, when I was talking to my boys about what they were doing to kind of adjust to COVID. I mean, I'm like, I do yoga and I meditate and I journal, and my 21-year-old boys are like, yeah, Mom, that's not going to work for us. Like, I'm like, well, have you thought about trying meditation? And they're like, no, I don't want to meditate. So I do think you have to find what works. One of the things that I tried to do with them was to just create a safe, non-judgmental space to listen to whatever it was that they were going through. And I did that by providing food. So I would cook, and I would say, hey, I have food here if you guys want to stop by. And just pick it up. Like, I try not to make it a big commitment, but a lot of times once they got in the door, they'd start chatting. And I think, it's just trying to find something that works for you, but then that's not always going to work for somebody else. And you can help to create a space that's safe for the people in your life. It might not work for them what you're doing, but you can try to figure out what might work for them, and then just find a way to make it, like, squeeze it in there, hide it, tuck it away, especially I think with young people, telling them to meditate was not going to work, but making food and just kind of being there to listen, I think was a good solution. And they took advantage of it. I don't think they realized it, what they did.
Well, again, I'll echo as I had said before that, letting people know that it's okay to feel what you're feeling. Right? So it's okay to grieve the loss of your relationship. It's okay to love the person who also did things that were abusive. It's okay to miss them. It's okay to talk about all of that. So that's important messages, that we want to share with people who are experiencing those sorts of losses or grief. And again, echoing that, as Carrie had said, grief is not a linear process, and grieving isn't. And so also then how you respond isn't kind of this kind of linear as well, kind of set that this will happen this day, and then the next thing will happen the next day, right? It can vary each day and what you need, even, and for myself as well. So when I've dealt with grief, at times it might be talking with someone who's just there to listen, and at other times it might be where I spend some time just journaling to myself or reading and kind of escaping that way. So that can vary depending on the day or even the hour of what people need.
New tips, because I think I went over some. I think one of the things that is most important, what everyone said is very important. And I would say the concept, and I know you've heard this before, is to be mindful. And so what we mean by being mindful about things is paying attention. And so we can be mindful about all areas of our life. One of the easiest, simplest, but maybe the hardest thing to be mindful of is our breath. But we do know that regulating our breath and breathing is one of the fastest and easiest ways to bring ourselves comfort and calmness. And so by just paying attention to your breath coming into your body and then steady out, leaving your body in through your nose and out through your mouth as you're breathing, like you're blowing out a candle. Sometimes something as simple, but yet very difficult for someone to do actually, can be so helpful, and it can take 3 seconds, 5 seconds in the moment, but it actually really works to calm the physical body so that maybe you can calm the mind as well. So being mindful of our breath, being mindful of our thoughts, paying attention to what our thoughts are. We can have all of the thoughts. We can have all of the thoughts that we can in our brain, and we don't have to act on them. We can pay attention to them, allow them to come in, and like a train, allow them to come out the other side without having to act upon them. And so be mindful of our bodies, what our bodies are doing, what we're feeling. Do we feel tense in our chest? Do we feel restless in our legs? And kind of paying attention to what our body is doing and providing relief where you're feeling tense or you're feeling pain. Being mindful about what we put into our bodies, what kind of food and drinks that we're putting in. If we want our mind to be healthy, our body has to be healthy too. And so we feel better when we're putting healthy things into our bodies. So eating healthy, being more physically active, just kind of general paying attention to ourselves, which is really hard to do because we often very much are paying attention to other people, other things, the news, our family, what's going on around us versus what's going on inside us. So sometimes taking that turn is really difficult, but that can really help you start that healing process.
I always like to piggyback off of things that Carrie says. I think along with mindfulness is being mindful of your recovery. So I'm thinking, especially during COVID, I can't remember what the exact statistics were about alcohol use, but for people who were stuck at home, the increase was probably like 200% or something. Especially women, they had higher numbers that were, home, working from home full time, becoming their kids' teachers full time. Alcohol's easy to turn to. So I think being mindful about, what you're putting in your body, but, also being mindful that substances can sort of put your grief on pause. So where you think that you're experiencing, a little bit of reprieve from that, you're not able to process that grief and go through the things that you need to go through when you're using substances. So making sure that you maintain a connection with, a sober support community or something that helps you work through that. And being mindful that it could become a problem if you're home every day and, that's your only go-to for dealing with this massive pandemic. And I would echo, engaging in things that you like to do, trying to pick up something that you can get into at home, like gardening or, going to the park or riding a bike. I think bikes sold out right during COVID was a popular choice. So just something that you can find interest in that's a healthy activity.
At what point would you recommend that someone talk to a mental health professional about their grief? Are there specific warning signs to watch for?
I don't think that there is a right or wrong time to go and seek out mental health, support. It's really a personal choice, and I think that a lot of people have strong feelings either for or against, and if you don't want to be pushed into doing it, if you're not ready, then don't do it. But keep an open mind, and when you are ready, I think it's very important to make that call and get yourself in there, and also know that there's not, a point where you're saying, okay, things are really, really bad for me, so now is the time to go. It's important to go and seek help even when you're feeling well. And I think sometimes we forget that, and going along with that, the grief and, mental health is not a linear process, and there are not stages that go in order. There are good days and bad days. So today might not be a great day, and you might not have the energy to reach out and get support. And tomorrow maybe you're feeling good, and then you decide that you don't need it because you're feeling good. But just keep note that the good days and the bad days are deserving of mental health services.
I think I'll just add to that also as parents or caregivers that if you're a parent or a caregiver, knowing that getting help sooner rather than later, it helps to support your role in taking care of others, and also role modeling what that looks like to be able to ask for help, seek support, and get the tools that you need. And so there's always that piece of things when we have little ones looking up to us, or even if they're not so little. I know that even though my boys are 21, I know that they still look at what I do as ways of what they should do or shouldn't do. And they might not say it, it might not express, but I know that my actions mean something. So.
And going along with that, I think that message that, right, at any point you might feel like reaching out for mental health help, is important or an option. I think especially with COVID-19, that's really kind of, that's been one of the positives, I believe, is that people have begun to talk about that more. It's like, this is an option and an awareness, even kind of on a state level, saying, there's a hotline to call, or, and certainly when we're talking with people, meeting with people, we always talk about, as an option for additional support, would be contacting mental hygiene. And for some people, it might be more in a crisis period of time when it really does, it feels like they're being affected in their ability to take care of themselves or their children, or, their work functioning or their school functioning, or, those are definitely times as well to kind of be aware.
I love therapy, and I think everyone could benefit from therapy at any point in their life. So I really appreciate what you said, Emma, about there is no right or wrong time to seek therapy. We don't always go to our physical doctor only when we're sick. We go for well visits also. So I think therapy is something that everyone could benefit from for a variety of reasons. So I wouldn't say there are specific warning signs for someone who may benefit from mental health therapy. I think at any point in time you can. So if you want to, come see us. We're really nice. We're really pretty cool, but we can help. And, I would encourage you, just as we take care of our physical bodies, it's just as important to take care of your brain and your emotional body, if you will. So I think anytime is a good time. We are not permanent. Just because you come see us once doesn't mean you have to come see us forever and ever. Like Christina said, sometimes there are times you need us for 1 time, 3 times, sometimes longer than that, but it's up to you. It's up to you and what you need, but nothing has to be wrong for you to come have some therapy to kind of either re-up yourself or to help you through a really difficult time.
So I noticed that the question said, at what point would you recommend someone else talk to someone? So I will just say that if you are in contact with someone and you're wondering when you should tell them they should go to see someone, obviously, if anyone says anything about wanting to hurt themselves or to hurt other people, I would strongly recommend that you suggest that. So as far as other warning signs, though, everyone's so different, and you may or may not see warning signs. And going back to the survivor's guilt, that's really not your job. It's not your specialty. So I don't want you to end up blaming yourself if you didn't see the signs to recommend that. But I would say it's probably good to go with your gut. If someone brings up something to you that you feel like is over your head and you want to be supportive, that would be a good time to recommend it. And, also I think the clinic, mental health and our substance use clinic is really working to break down the stigma and to change the perception for people. So, coming to the clinic means I have this thing wrong with me. And so we're trying to change that. It doesn't mean that there's something wrong with you. It means that there's something you're struggling with. So just like if you were struggling with diabetes, you would go to an endocrinologist or, a doctor that specializes in that thing. It doesn't mean you are diabetes, right? So just keeping in mind that, there is no wrong time. Obviously, if things are extreme or you're in crisis, you feel like I just can't take it anymore, I can't handle it anymore, that would be a good time. Or any time outside of that.
How has the COVID-19 pandemic affected children? What signs of grief do you see with that population, and what strategies can help them?
One thing I just want to mention that would be more specific to kind of looking at issues of abuse. One thing that we have seen kind of regionally is with youth kind of having, as many of us, really such more involvement with virtual kind of, for school and for socializing, and whether that's texting or gaming or Zoom or any of those things, the risk of exploitation online has certainly increased, where there are people looking to exploit children, whether they use that as an opportunity. So that's something definitely we've been really, aware of and concerned about. So, important tips, I would say, kind of related to that would be kind of the involvement of the adults in the children's lives is really important. So I know for myself with my children, I don't even, know most of the kind of apps and games and things they're interested in unless they share that with me and show that with me. So, so rather than even expectation that they're not going to do it, that they're not going to be involved in kind of, gaming or apps or things like that. I mean, recognizing that, yes, this is a part of their life. And instead, if I can be engaged and interested and look at ways that we can kind of more safely be involved in that way. So for us, that's been, an important piece to kind of keep in mind with our work with young people.
Okay, COVID has affected children in such a variety of ways, and as I kind of said in the beginning, it's changed every aspect of their life. So what you may see, signs of grief. They will grieve completely differently than adults. They don't have adult brains. Their brains are in a constant stage of development and growth, and so that's how they will kind of do their grief. Children do their emotions through their behaviors. So whereas some child could say, I feel sad because of this reason, another child might show us through their bodies, through their behaviors. So a lot of typical things we will see is an increase in body movement. So maybe we'll talk about hyperactivity, but maybe children are moving faster or harder or with more force or speed than usual. So that may look like children playing rough on the playground. Well, we're playing tag and he pushed me down to the ground. So that may be something that tells us that this child is dealing with some bigger emotions that they don't know. Maybe there's less control of their body behavior, so it turns into hitting, slapping, throwing things. Maybe it turns into not being able to handle transitions. So if we're going from playing the game to now it's dinner time, maybe that's a bigger, a harder thing for a child to handle during those times. Maybe they're having a hard time connecting to others. So maybe you bring them to a sports team and you notice they're standing away from the team, whereas the other kids maybe are socializing with each other. Maybe they're struggling with how to make a friend or how to continue that conversation. Maybe children are having a hard time following directions. So maybe they're having a hard time hearing the words that come in, or maybe they're having a hard time connecting the words that you gave them to their hands or their body. So that can look like they're not following the directions or doing what you're asking them to, but maybe there's a disconnect somewhere. Maybe I've actually heard children tell me a lot of times that they missed directions in the classroom because they were thinking about grandma in the hospital, because they were worried about this at home. But maybe to other people that looks like they are not listening or they're purposely not following directions, but it's because these other things are going on in their lives. So we will see that through their behavior. And most of the time it looks like bad behavior. And that's kind of the typical thing that we'll see. Children also will internalize and become more quiet. So maybe we're not noticing them a lot because they're more quiet, they're not eating as much, they're not talking as much. And so sometimes they're not the problem behavior children. So maybe we don't notice that as much, but that could be a sign of a child struggling also.
Just a couple more things in younger kids, the toddler age group, you might have a kid that was completely potty trained and then all of a sudden they're wetting the bed, they are having accidents. That's not uncommon. You might see more clinginess to mom or dad or caregiver. If you normally have an independent kid that will go off and play on their own, or vice versa, you might see a kid that's completely withdrawn from family activities that they might normally, be involved in kind of center of attention. So all kinds of different things than what the norm is. And I think just keeping in mind that, they're going through this too and trying to navigate, how to wear a mask, how, you know, how to kind of stay away from their friends when they're used to, you know, hugging or like really being close to them, and that their whole world has changed, you know, and it's just different. So just having a little bit of compassion and you know, trying to think about how you would handle some of those things a little bit differently.
Carrie, I actually have a quick question for you, following up on that with the school year approaching. What are some tips you have for, you know, talking to kids? You know, COVID is still here. And I see a lot of the articles of kids being fearful of returning to school because it's not that normal that they're used to. So do you have any tips for parents or families to kind of prepare their kids for the upcoming school year?
Okay, good question. Okay, so children's perceptions will come from their parents and the people around them. So again, if I'm going to use mindful, be mindful of how you're talking to your children and what you're saying to them about school. School is going to start for however way your school district is going to start it, and however you decide for your child, but it's going to start. And so I would ask you to be mindful about how you're speaking to them. If you're speaking to them and talking about in a negative way, you know, oh, this is terrible, or this is going to be awful, you're kind of setting them up to have that expectation. So I would encourage you to be hopeful and positive with your kids and say, you know what, this is going to be a different school year, but we did have a school year last year. You know, some things were different then. So I think, you know, some things are going to be different this year, but some things are going to be the same. You know, we're still going to get through the day together, you know, and you're still going to meet friends and meet teachers and have a good time and be able to, you know, play games, go to PE class and learn new things. So kind of talk to them in a positive and a hopeful way versus in a negative way that gives them that chance to set up their school year in a positive way. Talk with your teachers, talk with your principals. If you have worries as a parent, ask them, reach out to them. They're willing to talk with you and, you know, give you as much information as they have. You know, and you can let them know about your worries and you can talk to them, you know, about that versus kind of letting your children know how worried you are. And I think that's kind of where I would go is approaching them in the positive way so that you can set them up to have a good school year because, you know, we're getting set and ready. Things are going to look different at school, but things are also going to kind of be the same. And I would remind them, we did go through a school year last year. We did. It was there. It was all new to everyone, but we all did it together and we all adapted together. I saw it. Kids had fun. Kids made friends. Kids did well. You know, kids did struggle. We all did. But for the most part, I think the kids really did well.
I just want to add one thing because, you know, we think of kids and we think of the little kids sometimes. And so someone had said this to me last year, for kids that are going to college, kids that aren't able to go to high school and do it the way it's supposed to be, right? So, you know, parents have had this experience before where they've gone to school and they've gone to college and this is the way it was. And so a lot of parents have expectations about what they want for their kids. They want them to be able to go to school without masks. They want them to be able to go away to college and live in a dorm and do all the things they got to do. But, you know, those kids haven't experienced that yet. So, you know, if they're going away to college for the first time, you know, they don't really have anything to compare it to. So I think it's important to stay positive about, as positive as you can about what is happening now and, you know, what it might be like and how it might be different, and to recognize that it might not look the same as how it looked for you when you went. And that might help them embrace, whatever's coming.
What are the long-term effects of grief that our community should be aware of?
Well, I don't know if I can speak specifically to grief, but I will say that I think with trying to return a little bit back to whatever this is going to be, past lockdown and returning back to, some of us are back in offices, at least, part-time, back in schools, whether it's with masks or without masks, but knowing that community is not just our community, but there are going to be effects. And I know that one of the things myself and our agency is doing has been shifting our focus a little bit to support more social emotional learning, building community resilience, and trying to help to reduce stigma around reaching out and getting help and getting resources, because I don't know exactly what the long-term effects of grief are going to be, but I know that we're going to have long-term impacts in our communities, in our families, with parents, with kids coming out of, being at home for a long time. Even if their home situation was positive, it still just was so different. And I think also unfortunately for many young people, home life was not a positive experience during the pandemic. And so we have to be building ourselves up as the helpers, as professionals, to be able to help with the outcomes of that. I don't know, I'll let you guys speak to what that is probably going to be, but I just know that, being able to shift focus from how we were traditionally providing support, and it's going to look a little bit different now, because we're going to be looking at, how do we help to mitigate what some people were experiencing during this time: substance misuse, mental health issues, that we all are going to have to be aware of it on some level, that something is going to happen that we have to be cognizant of.
Right, yeah, and in the same vein, just as you're saying, that idea of as a community, whatever those effects will be, us being ready to kind of be there and address and provide support and resources, and really even having opportunities like today to talk about this, to kind of really process as a community, and however that happens, if it's, opportunities like this, or through social media, or in the way that we're providing services, that we as a community can respond to what those effects are.
So long-term effects of grief on a community do not be bad or negative. They can be good and positive. They can bring us strength where we didn't think we had it. They can bring us togetherness. They can bring us a sense of community. They can bring us flexibility. They can bring us more focus on time with the family. It can bring us these good things. So these long-term effects may be building up our community, building up our resources, building up our collaborative nature. But now also, specifically with this COVID, we've built up this network of telehealth and virtual connection that we definitely never thought that we were going to have, and definitely not as quick. But look how quickly our schools could adapt to things like snow days, now things like floods or illness, or whatever. If someone has to be out for a long period of time, maybe they had an injury or a surgery, now they maybe won't miss school. Maybe they are housing fluid and they're not in stable housing, but that doesn't mean that they can, that they have to miss going to school, whether they're in and out of district or not. So there are actually these kind of areas of growth and strength and togetherness that I think hopefully will overpower any negative long-term effect.
And I know like loss of area businesses could be a long-term effect for any community. So, I think it's important to try to, support local. Curbside pickup delivery was, a big thing that came out. And, just trying to, in the way we support people, support businesses, long-term effects of grief, I think, is when it's unresolved, so leaving it, leaving that way, not dealing with it, for people can turn into anger and rage that just doesn't seem to go away. Carrie mentioned earlier being stuck in certain stages. So, I think just be aware that people, did have multiple losses and, could be experiencing this longer term and, there are resources out there to help manage those.
Okay, I'm going to open it up